So, what do you guys think about driving after marijuana use? It seems intuitive that because marijuana impairs our memory and also our ability to process and register information appropriately and slows our reaction times, that marijuana use and driving is not a good idea. And this is one of those areas that we need to address as public health professionals because there is that gap in current legalization and consequential driving. We have some tools in place to assess for driving under the influence of alcohol, but those tools are not necessarily appropriate for uh, marijuana use. For example, the roadside sobriety test may not be appropriate, and there's no breathalyzer test for marijuana, and the urine and blood test for marijuana goes back in time. It doesn't necessarily indicate that somebody used hours before. So that is an area for further research. Some limited research does indicate that young people drive after marijuana use and perhaps perceive it as less dangerous than, say, driving under the influence of alcohol because the intoxication is not the same. Additionally, marijuana smokers or marijuana users are more likely to get into motor vehicle accidents. So, what are some of the physical effects of marijuana use? It's bad for the lungs, bad for the respiratory system. Today's marijuana is 10 to 20 times more potent than the marijuana of the 60s and 70s. It has many chemicals and it inhibits the ability of macrophages, which are like the lungs' little Roomba vacuums, where it goes along the surface of the lungs and cleans up the debris. So the macrophage is less able to do its job because of marijuana use. Marijuana use is also bad on the heart, limits the amount of oxygen that can be carried to the heart, and that decreased blood pressure or vasodilation that we talked about earlier. Marijuana even affects your sexual performance. It may increase arousal in some cases and decrease arousal in high doses. It may also delay ejaculation because of vasodilation in the genital area. Next, let's take a look at amotivational syndrome. Amotivational syndrome refers to that general lack of motivation or interest in pursuing goals or being productive. Other characteristics may include memory problems, concentration problems, and a general dislike or negative attitude toward things. You may recognize this character, Spicoli, from Fast Times at Ridgemont High. He may be suffering from amotivational syndrome, as his only concerns in life were smoking pot and surfing. Next, let's take a look at the therapeutic uses of marijuana. Here we see a long, not extensive list of some of the therapeutic uses of marijuana for many symptoms from many conditions. One is as an appetite stimulant because some conditions cause wasting or lack of appetite. This can help stimulate that, especially those that have cancer or AIDS and going through difficult treatment procedures like chemotherapy and radiation. Another therapeutic effect are anti-asthmatic. Short-term smoking improves breathing for asthma patients because of bronchodilation. I know this seems kind of counterintuitive because you're smoking something and that's supposed to help open up your bronchial system. But it is, again, short-term smoking of marijuana improves this bronchodilation. It's also used as an antidepressant, muscle relaxant, pain reliever, and an anti-seizure medication. Let's go back a slide. So, in addition to smoking medical marijuana or consuming one of the edibles or topicals or concentrations of marijuana, there's also Marinol, which is an FDA approved THC in capsule form. I didn't mention glaucoma. Glaucoma is probably one of the first conditions mentioned as being helped by marijuana use. Lastly, what are the arguments against marijuana? We've already mentioned most of these, that it's bad for your lungs, contains many chemicals, is much stronger than it was in the 60s and 70s, impairs memory, reaction times, cognitive functions, and lastly, that it's illegal in the eyes of the federal government. This concludes your lecture for Chapter 13 on marijuana. Thank you for your attention.